The following program is intended to educate the public on a variety of cosmetic procedures and is paid for by the participating doctors.
Hi, I'm Vicki Liviakis. Welcome to Body Beautiful. This is a show where we talk with local professionals about the latest in cosmetic procedures and medical devices. We also take your calls live on the air. With us today, we have plastic surgeon Dr. Elizabeth Lee. We're talking about liposuction and all the new technology. Later, we'll be taking your calls, answering any questions you might have. Here's the phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And before we get started, any advice we give you today, certainly you'll want to consult your own physician as well. Welcome back to the program, Doctor.
Thank you.
Liposuction's been around for a while.
Yes, it has.
But it's constantly improving, and we're here to talk about some of the latest techniques.
And you know, it's constantly changing. I'm not sure that we have any kind of huge improvement in the technology.
So basic liposuction is one of the top plastic surgeries
procedures
being done in the U.S., isn't it?
Right. It is. You know, liposuction by itself is what we call minimally invasive, in that we make small incisions and we can accomplish a lot through small incisions. But basically, there's all sorts of new technology to try to make things both easier for the surgeon and to make skin tighten up afterwards. And so we've seen ultrasonic liposuction, and now we have the new laser lipo of various sorts, which are being very heavily marketed to the public.
Okay, this is that time of year where we're making our lists, you know, self-improvement, you know.
Right.
Is this one of those areas where, you know, you could approach, you know, working off some problem areas and actually get fairly quick results?
Yes, liposuction will give you fairly quick results, exactly. However, liposuction is not a weight loss procedure, and it really should never be looked at as a weight loss procedure.
Well, it's also, this is a controversial side of it.
Right.
You know, if you take too much, it can actually be very harmful to you.
Right, and you know, what I always say to patients is that liposuction is an appropriate procedure to do for those problem areas, those little bulges that don't go away even when you're at close to your appropriate body weight. And so I sort of think of it as sculpting as opposed to big reduction. Because if you do a reduction in an area that's always a little bit bulky, you'll be more smooth, and you'll gain weight less preferentially in that area.
So the limits of liposuction?
Well, I mean, you know, it's a judgment call, and a lot of physicians feel differently about it. But basically, my concept is that what's appropriate is to sculpt little areas. If you have liposuction and you take out a large volume of fat and you're still taking in more calories than you're burning, you're going to store fat elsewhere in your body, and that might be in places that might be more dangerous to your health, like inside the abdomen or around the heart, these other places where you don't generally gain weight but where you will as alternate fat stores.
Okay. This may be a stretch,
yes,
but we hear a lot about when fat accumulates around the heart, which is anywhere in the midsection, that it is bad for the heart, that it taxes it, and that you are predisposed to getting a heart attack. Is liposuction an answer to that?
No, liposuction may actually be one of the causes of preferential storage of fat in this area.
Oh, really?
Yeah, because what we're talking about is increased statistical risk for vascular disease, like heart disease and stroke and things like that, when you have a higher concentration of fat inside your body cavity, so inside the abdomen, as opposed to that fat that is outside the belly wall but underneath the skin, which is the area that we do treat with liposuction. So again, if you have liposuction of large superficial areas and you still are taking in more calories than you're burning, your body's going to store it in the areas where there's still fat left, which will be inside your abdomen.
So this is liposuction is not permission to overindulge in unhealthy lifestyles and consuming large quantities of fat.
Exactly. Thank you.
Darn. Okay.
Sorry.
Okay. All right. We want to talk about some of the new technologies that make it easier not only for the physician but also for the patient in healing and in precision.
Right.
But we need to take a very quick break. For more information on Dr. Lee, you can call her directly, 510-704-2170, or check her out on the web at artfulsurgery.com. And when you call Dr. Lee and mention the show, you can receive a 30% discount on Radiesse. That's a filler.
That's right. It's a fabulous filler.
Yeah, it's great for New Year's. We'll take your phone calls and show you some before and after pictures when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of Cron TV, its management, employees, or advisors.
Welcome back to Body Beautiful. With us today we have plastic surgeon Dr. Elizabeth Lee. We're talking about liposuction and all the new technology. Later we'll be taking your calls, answering any questions you might have for the doctor. Here's the phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office. We'll be ready to jot that down. And certainly you want a second opinion before you involve yourself in any kind of medical procedures.
Absolutely.
You brought some photos. Let's go ahead and roll those and take a look at some people who have had liposuction.
So this is a patient. The preoperative pictures are on the top and the postoperative ones are on the bottom. And this is a young woman who, from the time she was a teeny tiny baby, was thin and had a big round tummy. And as she's gotten to be a young adult, no matter how much exercising she does, and her body weight is appropriate, she always has that pooch. So this is a perfect candidate to do some liposuction, and you can see that she's gotten a much flatter contour and she's much more comfortable in general.
So that's just liposuction?
That's just
not
liposuction. There was no tummy tuck.
So the muscles were not lax?
No,
it was just
right.
fat?
She just had this bulge, and it's, you know, her mother says, I've always had that too. So it kind of runs in families, and she's a perfect candidate because she's not overweight, and she could drive herself crazy exercising and trying to lose that last 10 pounds, and it could become obsessive. And these are, you know, her pictures from the back. We did a little bit around that the flank area too. You can see she kind of had a tire running all the way around, but her hips are narrow.
We call it the muffin top.
The muffin top, yeah.
Love handles.
Love handles. There are nice names for it, but whatever it is, whenever she put on a pair of jeans, she was a couple of sizes up because of her waist, and nothing would ever fit properly around her legs, and she just felt awkward, and it became kind of an obsession for her to think about dressing around these gluppies.
Okay, gluppies.
Gluppies,
Is that a scientific term?
Yeah, that's my cutie term. Yeah.
Okay, and this is another patient.
And here's another patient who's, as you can tell, is in excellent physical shape, was a long-distance runner, and she said, you know, the inside of my thighs chafe all the time, and you can see where she has these bulges just on the upper inside aspect of her thighs. We did a little bit of the outside of her thighs too, and you know, again, a thin patient who is in otherwise good physical shape and just has bulges that are hard to get rid of.
Exercising was going to get rid of that.
I mean, I suppose that if you dieted down to a weight that was not healthy for you, you might reach a point where those also were smaller in size, but that's not appropriate either.
Sure. You mentioned one of the earlier pictures that we were looking at was a teenage patient. How young is too young for?
She was actually not a teenager. She was 20, but you know, that's a good question. How young is too young? I think it really depends on making sure that the patient, whatever age, has stopped growing, because things will change as long as they continue to grow, and so you might outgrow this kind of thing. Also, you know, it's important when you deal with teenagers that the parents be on board, that everybody has appropriate expectations, and that it's something that is not being done kind of because they're immature and impulsive.
Okay. And conversely, how old is too old?
You know, it's really an issue of your health. You know, if you're old, but your heart is in good shape and your lungs and kidneys are in good shape, and you have the kind of skin that has maintained some good bounce back, you know, liposuction may be appropriate at any age.
Okay, how about the results? I mean, are they permanent, or do you have to keep doing this?
No, it's an excellent question. What we're doing is reducing the number of fat cells in this problem area. When we gain weight, we don't make more fat cells. The cells that we already have become larger as they store more fat. So what we're doing is a permanent reduction of the number of fat cells in the problem area, so that as you gain weight, it will be gained more evenly, not always preferentially in this area.
So the body does do that, right? They're just, each one of us is programmed a little differently, that we have our trouble spots.
Yes.
I mean, by and large, men maybe gain weight
right around the middle, and women tend to gain weight
in the hips
until they get, you know, menopause, and then when menopause happens, weight gain patterns change too.
Okay. Is it everywhere?
No, but it's much more common for women to start gaining weight around the middle after menopause than it is premenopausal.
Okay, so the estrogen and lack thereof.
Right, and I'm not an expert in why that happens. I just know that it does.
Okay. Well, we need to take a very quick break.
Okay.
We've got some phone calls we'll get to, but for more information about Dr. Lee, you can call her 510-704-2170, or you can check her out on the web at artfulsurgery.com. And here's a special offer. When you call Dr. Lee and you mention Body Beautiful, you can actually receive a 30% discount on Radiesse, and Radiesse is a filler
for facial wrinkles.
For facial wrinkles, and you get pretty much instant results. When we come back on Body Beautiful, we'll continue talking with Dr. Lee about liposuction. We'll take your calls and really walk through the process.
Okay.
Okay. We'll be right back. For more information about our show, go to cron4.com and click Body Beautiful. Once there, you can see videos of past shows and get contact information for the doctors we featured, as well as listings for future shows. Welcome back to Body Beautiful. With us today, we have plastic surgeon Dr. Elizabeth Lee. We're talking about liposuction. We still have time to take your calls. Here's the phone number, 800-440-4884. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. And any advice we give you today, you certainly want to have a second opinion. I want to ask you about cellulite.
Okay.
Cottage cheese.
Yeah.
Can you lipo that out?
In short, no. What happens with cellulite is that there are connections from the skin, from the deep layer of the skin, the dermis, to the underlying muscle. And that's really what keeps your skin from sliding, you know, so that your thigh skin doesn't end up down in your ankles.
Okay, we don't want that.
No, but, and obviously there's great genetic variability. You know, different people have, some people have it, some people don't. So liposuction, in a lot of cases, can in fact make that worse, because you can make more dimples. So there are some cases in which you can use a very, very small cannula, and you can do some very slow, deliberate work, and you can make it better, but you can also make it worse.
Is there anything that works for cellulite? Lasering? There's all kinds of contraptions. You hear about them in creams.
Right, exactly. The creams don't work. The caffeine cream doesn't work. Most of the reason why none of that works is that nothing that you apply on the surface gets through the skin. The skin's function is to keep things out.
I know some athletic people.
Yes.
They're very muscular, and they don't have an ounce of fat, and they still have the cottage cheese.
Right, exactly, because everybody has a little bit of fat between their skin and the deeper connective tissue layer overlying the muscle.
So what do you do?
In most cases, you live with it, and that's it. But, you know, there's some promise with the laser liposuction that by heating the skin, you may get, from underneath, you may get more even shrinkage of the skin. I think that there is nothing out there that has shown universally that it works well.
Okay, we promise we talk through the whole process.
Okay.
What is the difference between traditional liposuction and laser lipo?
Okay, so the difference becomes whether or not you're delivering an additional energy besides just the force of the surgeon's hands doing the liposuction. So with the laser lipo, what we're hoping to do is to deliver energy to the fat that dissolves the fat, that also heats the skin from underneath, so that you may stimulate more collagen production in the skin and therefore tighten up the skin.
Right.
Exactly. And you know, there's some question that by doing laser lipo or like doing ultrasonic lipo, which is the previous iteration, that you're getting less blood loss and less bruising because you're disrupting just the fat and not the vessels.
Right.
That there are pros and cons to looking at it that way. And basically, you know, liposuction is still liposuction.
All right. I want to jump to the phone lines. We have Kimberly from Fremont. Kimberly, good morning. Do you have a question for the doctor?
Yes, I was wondering, I had lipo about 3 years ago, and my stomach really looks really bumpy.
Bumpy.
And I'd like to know what's that caused from.
Well, you know, it's hard to know for sure without actually examining you, but what can happen with liposuction is that you leave little pockets of fat that are not really obvious in the operating room, and other areas that are more suctioned, and so that combined with some scarring can leave things lumpy.
Okay, I don't want to say anything bad about the doctor that did the work. A couple things here. One is you want to have a surgeon.
Right,
and board certified.
In this competitive environment where all sorts of people are trying to get into the cosmetic surgery area, and where our laws are such that they can do it, it's very hard for the consumer to know who they're seeing. And so you want to make sure that you're seeing, number one, a surgeon for liposuction. Number two, that the procedure is being done in an operating room, preferably an accredited operating room, not just in the office. And number three is that you really want to ask the surgeon what their board certification is in. You want to ideally make sure it's the American Board of Plastic Surgery, and you want to ask the surgeon, do you have privileges to do this in a fully accredited hospital OR? Because that's the way you can differentiate in training.
Kimberly, I don't know if you're still on the line, but should she go back in? I mean, can she correct that problem, or is that permanent?
No, I mean, there may be some things that can be corrected. If it's a couple of little bulges, you can do some touch-up liposuction, which is a very small procedure. But again, it really depends on how bad it is. Sometimes, I've done a fair number of patients who've had liposuction have ended up with a tummy tuck afterwards because we have to get out the skin and smooth everything out.
Okay. We need to take a very quick break. I'll try to get to the other phone calls and answer some more of your questions. For more information about Dr. Lee, you can call her at 510